Welcome to our joint event this morning. So it's being run by the NIHR Statistics Group and also the Methodology Incubator. So we're going to start with a brief introduction to both of these groups. And then the main part of the morning is going to be in two sessions. So the first session is going to be a series of career talks. And we've got speakers from a variety of sectors. So academia, clinical trials unit, the NHS, the charity sector and the pharmaceutical industry. And then the second part will be a panel discussion, question and answer session with all the speakers. So we're not going to be having questions directly after each of the 5 presentations. Please do put them in the chat during their talks and during the panel discussion, and we'll collate the questions and ask them all in the second part of the morning. So we will also be having 2 short breaks through the morning as well. So we'll start with the introduction to the NIHR Statistics Group. So this is going to be, I've got a recording from Dr. Katie Bunce for this, because she's unfortunately unwell. So bear with me a moment while I just try and get it playing. No, not that one.
Thank you for joining today's event. My name is Katie Bunce and I'm a Clinical Trials Unit Manager at the Royal Marsden NHS Foundation Trust, and I jointly lead the NIHR Statistics Group with Dawn Tier, who's a Professor of Biostatistics at Newcastle University. Dawn also leads the NIHR Methodology Incubator, which she will introduce after this talk. This is a very brief introduction to the NIHR Statistics Group. I'm going to say a little bit about how and why our group was formed, describe our membership and the various groups, and outline the types of activities that we get involved with. And then I'll finally give you some information about how you can find out more about us or even join our group. Before I introduce the Statistics Group, I thought I'd say a little bit about the NIHR itself. It's the largest funder of health and social care research in the UK, spending around £1 billion annually, and it's a virtual organisation that supports translational research across the NHS and partner universities. Its mission is to improve the health and wealth of the nation through research. The NIHR provides the support and facilities that the NHS needs for first-class research, and it does this by funding an infrastructure, which includes biomedical research centres, clinical research facilities, BRDS, CTUs, and more. And I would imagine that many of you joining today come from or work within these groups, and so are better able to describe what they do than I am. What we can note, however, is that statisticians are required at all stages of health and social care research, and therefore statisticians are embedded across all the centres. This can mean, however, that the statistician can be isolated. In response to this, in 2012, Victoria Cornelius and Professor Janet Peacock ran the first NIHR statistics meeting. Invitations went out to statisticians throughout the NIHR research infrastructure. The meeting was very well attended and very well received. And networking and discussion groups were fostered from the start. For those of you who were lucky enough to go to this meeting, it was quite a different sort of meeting to many statistical meetings. There was a kind of speed dating event where you had to introduce yourself to others working in different parts of the NIHR. Statisticians who attended did indeed mention isolation, but also indicated how they would very much welcome the opportunity to network at a national level. And so the NIHR Statistics Group was formed with a view to linking statisticians across the infrastructure to allow sharing of knowledge, of expertise, to come together to talk about challenges and maybe to try and work out how to solve these. With support from NOCRI and various BRCs, the NIHR Statistics Group evolved. Initially, the areas of activity were as identified here. Different groups worked in different ways. Some groups organised on meetings, others collaborated on publications, some were designed to bring both statisticians and non-statisticians together, whilst others were purely for statisticians. In 2007, we ran our first conference, which was targeted at statisticians at that time. We wanted it to offer something that met our member needs, and this was done by essentially inviting members to lead their own breakout sessions. We also provided lots of opportunities for networking. Some of the sessions were discussion groups and others were educational, for example, updates from ongoing statistical projects. 3 further strong groupings emerged from the annual conference: routine data, statistical literacy, and the career development group, who kindly organised today's session. This group has added an early career event to the conference and established a mentorship scheme. To summarise, our collaborative network has been nurtured, fostered and developed by the critical mass and enthusiasm of our members. Different groups operate in different ways, and groups have established where there is a need for collaboration and activity is acknowledged. We now have a steering group and an executive committee, and the steering group will support the development of new groups. More recently, we have groups in risk-benefit analysis in clinical trials and social care. There's no specific expectation on how a group has to operate. It's driven by the members who attend and bring the enthusiasm.
Okay, so Katie's last slide, she wasn't able to update. So I've updated it with the details of our annual conference. So I'll just briefly whiz through that one now to finish off this section. So if you are interested in joining the NIHR Statistics Group, please go to the website and you can sign up. This just means that you'd then be on our mailing list, so you get all the information about all the events and things, and occasionally we do run surveys, so it's that kind of thing. And we would really welcome you to our conference. Our next conference is going to be on the 23rd and 24th of June. It's going to be a hybrid conference, so it will be based in Sheffield as it used to be pre-COVID, but there'll also be an online version of the whole conference. So the theme is data science and statistics with health and social care. We do have some confirmed speakers, and we also have a wide range of breakout sessions, which are the more interactive sessions that run in parallel, so you can choose the ones that are most relevant to you. So please do have a look at that. There's more details on the website if you're interested. Okay, so now we'll move on to the brief introduction to the methodology incubator. So this is another recording, this time from Professor Dawn Teare.
Good morning, everyone. The Methodology Incubator is co-hosting this event today, and as chair of the incubator, it's my pleasure to welcome you all and to take the opportunity to give you a brief introduction and an update on the incubator's activities. The Incubator Initiative has been launched by the NIHR to help in a number of areas where there's a recognised issue with research capacity. These are career-focused initiatives, and it allows a bespoke community-driven approach. The first role of any incubator is to bring together stakeholders and partners to form the foundations for building identifiable communities. So early in the life of the Methodology Incubator, we had to adopt a definition of what we meant by an NIHR methodologist, and this was to clarify who we were to include in our community. The steering group agreed this broad definition was preferable that you can see on this slide, so we could be as inclusive as possible, which is especially important for those methodologists who may have trained via interesting and non-standard routes. So this list of specialisms here is constantly being modified and added to as we embrace the diverse community of methodologists. So foremost, we are about careers. We seek to increase capacity by attracting, retaining and rewarding people in methodological research. And an important emphasis of the incubator is to both increase opportunities and raise awareness for methodologists to do their own research and be able to secure funding towards it. So the way that we work is that we have a steering group and we have work streams who come together to identify issues for careers and capacity issues in methodology and for methodologists. And we make recommendations to the NIHR about how these situations can be improved. So we currently have 7 active work streams. These 3 of them are discipline focused. The statistics and economics work streams grew from 2 of the original. So the incubator was formed out of 4 original proposals, and the stats and the economics work streams were independent proposals. The qualitative work stream is new, and it's been formed from new members following the incubator launch 2 years ago now. The 2 application-focused work streams grew from the 2 original incubator proposals, and they're looking at the practical challenges of growing research capacity in emerging research areas. And our newest work stream is the information retrieval specialists, which has just been formed this year. So we are a community that's working to improve careers for methodologists and feed back into the NIHR what they can do to increase capacity for research. We're open to new members at all times. The work streams are open for anyone to apply to join. Please tell your colleagues about the Methodology Incubator, particularly any early career researchers. And if you're interested in knowing anything more about us, please contact the email address here, methodology@newcastle.ac.uk. Thank you.
Okay, so that's the 2 introductory sessions done. So we'll move on to the 5 main